Welcome to Pathway Patient Advocate webinar. This is our third or
Third one.
fourth,
Yeah,
something
our
like
third
that.
one. Yeah. So, welcome. Happy New Year. We are happy to, I hope everyone can see us okay. I don't know how the lighting is today, but we're happy to be here for another live Q&A session. First, let us introduce ourselves for those of us those of you that don't know us. My name is Elena, and this is Gabriella.
Hello.
And we are from Pathway Patient Advocates. Pathway Patient Advocates is a private patient advocate company that serves all 50 US states as well as Canada. And in many states, patient advocacy is a newer concept, and many people are not aware of what we actually do and who we are. And so we thought it would be a good idea to have a few different Q&A sessions where we could talk about what a patient advocate is and why you actually need one, and then really touch on each one on different topics. So today our focus is going to be on managing medical bills. And one of the services we have at Pathway Patient Advocates is to help navigate and negotiate medical bills. Now, most of us would agree that bills of any kind are a headache to deal with, but medical bills especially add a whole level of overwhelmingness.
Yeah, I think it's because when you're sick, especially in an emergency situation, you're focused on getting treatment and you need medically. And it's often until you are trying to recover after a treatment that you start receiving shocking bills and just being overwhelmed and then at that point you really don't know what to do.
Agreed. Then a person is trying to decipher what all these charges are, why are there so many bills, and it's a common question that we often wonder is what happened to the insurance. So you pay for insurance every month, and then you get a bill and you're like, wait, why wasn't it covered by insurance? So of course, also there's some cases where there's no insurance involved as well.
Okay, so before we get any further, let's take a look at who's currently joined in.
All right, let's see. So we got...
You know, Ellen, I'm terrible at this, so.
All right.
Where's Christine, our helper?
Christine, I think you're on. Christine, how are you doing with the chat? All right.
As we're waiting for Christine, or as she's responding, I just wanted to let everyone know, please feel free to ask any questions or add any comments in the chat. Mm-hmm. As we mentioned, Christine is our part of our team, and she helps monitor and moderate the chat today. Please, if there's anyone on the chat right now and you would like to share what state or country you are watching from, please do so.
So I see we have Max on, we have Vito, Rose, hello, and please feel free to, like Gabriella said, let us know what state you're joining us from, because we'd love to know if, we're familiar at all with your state. And like we mentioned earlier, we do have clients in all 50 states as well as Canada. Oh, we got some questions over here already. Okay, perfect. Well, let's kind of move forward then.
Okay, so first scenario, do I see it from Max? Am I looking at it?
Yep.
Okay, Max says, I received a bill from a specialist appointment for a small visit and procedure I had. Mm-hmm. He's indicating the bill shows that insurance didn't cover it, didn't cover the payment. The office did tell me that they took my insurance before I made the appointment. So it looks like Max made an appointment. He asked if it was covered by his insurance, and they indicated that it was. So what do I do? So what do I do now? What do I need to know? I work all the time. It didn't have time to call. Plus, I don't even know where to start. So it seems like they told him it was covered, but then the insurance is kind of reneging on their original plan. And,
okay.
They're not willing to pay for the service.
Sure. Well, first of all, Max, good job on checking, because that's actually important to try to check to see prior to if the insurance is going to say that they do cover. And so this is actually a common scenario that we deal with In this situation, there's many variables that could be causing the insurance denial. So the first step is reviewing and understanding your insurance policy. And while that sounds like an easy thing to do, it's actually quite difficult and it can be overwhelming. Even if you have the policy right in front of you, it's very often hard to understand. What we at Pathway Patient Advocates do is review your policy and then review the billed charges. Sometimes there's a coding error that we can pick up. Then depending on what we identify, we discuss further with the insurance company to see the specifics of why it was denied and then the next steps and duration of how to correct it. It's a timely process, but we are experienced and we handle this all the time. So we're pretty familiar with managing it.
Yeah. Can you maybe further explain what you meant by coding error?
Sure. So every procedure or medical charge is associated with a code that's used for billing. And there are so many codes to select from, and many of them are really similar. So sometimes the one is picked accidentally instead of another one, or sometimes insurance will approve a specific code for a procedure, but the one that your provider picked was not chosen. And so in many cases, an updated code can be rebuilt to the insurance and then it will be approved.
Yeah, well, thanks for explaining that. And I don't know that people are aware, but when we talk about coding, I guess it involves insurance and medical, and it can mean something different when you talk about billing,
yes.
coding versus depending on the type of procedure.
Mm-hmm.
There's so much to know
Correct.
in that kind of coding world.
Correct.
So it looks like we have another, do we have another comment or question on the chat?
I think we have one from Vito.
Okay, so Vito is saying, I have a family member who is trying to get a drug used in a clinical trial for cancer. So first of all, I'm sorry that your family is having to go through this, Vito, but happy that they were successful in finding a clinical trial to help with the cancer. And what he's asking for, the doctor's office said that the insurance denied the drug. Is there anything that can be done?
Great question, Vito. This seems to be a prior authorization or prior approval issue, and there are many specifics in relation to clinical trials. Given that one of our main focus is advocating for patients with cancer and rare disorders, we often encounter this issue. And there's several options to explore, and we're pretty good at helping navigate an option that will work for each specific scenario. So I recommend that you contact us and we can directly discuss the specifics of the situation a bit more to figure out really what's the issue. And a lot of times there are very small things that can be quickly fixed, and then everything goes through. If for some reason we actually can't get the insurance to approve it, there are other avenues to go through where you can still get into the trial.
That's a really good point, Elena. One of the things I think that's important to talk about, as you explain that Vito situation, is the fact that our plans are not the same for every patient. It's not the same recipe. There's a different recipe if we think of like a chef in the kitchen. There's so many different ways you can make the same meal, and ours is tailored. Pathway really has a situation almost for every client is different.
Great. Yes, I agree. Gabriella, I think we have time for another question.
Okay.
So I see one from Angelo.
Hello, Angelo.
Regarding shoulder surgery.
Okay.
He's saying he's trying to get surgery for his shoulder, but the surgeon office said that the insurance denied it. Or I'm sorry, not Angelo, I apologize. Antonio, I apologize. Antonio, is that correct? Is that your question?
There must be
Okay.
just a slight delay.
Great. Yes, I see it coming in.
So just to kind of reiterate, he is trying to get some type of shoulder surgery. So again, we apologize for the shoulder pain that you're probably experiencing, and
Yes.
the insurance is denying the surgery.
Correct. Okay. So this is another great scenario. There are different options when a surgical procedure gets denied. And typically what happens is pretty much every office or hospital, they actually run a prior approvals or prior authorization to see if the insurance will cover it before they go ahead and schedule the surgery. Unless it's like an emergency situation, then that's not always done ahead of time. But it's important to get to the root cause of the issue first, and then that will help drive the solution. So some examples of why it may be denied are, it could be another coding issue. It could also be that the insurance doesn't cover that specific surgery, but they may cover a similar one. Or perhaps it's that the insurance is not credentialed or not in network, the surgeon is not credentialed or not in network with the insurance company. Sometimes the insurance needs to do additional research, or they want some additional information from the provider. So in this case, being the surgeon. And lastly, sometimes there is a tiered approach required, meaning perhaps the surgery requires like physical therapy or like a least invasive approach to be tried first for the treatment. And then if that's documenting that it's failed, then surgical approach would be something that would be approved moving forward. So we actually published a blog this week on Greater National Advocate that talks a bit more about this topic in detail, and we encourage you to check it out. Christine, did you add the link to the chat? If not, I think, can you add it now for anyone that wants to continue reading it?
Oh no, that's a lot. That was a mouthful. I will add. I think as we know, and as the different explanation that Elena's been providing on just how to deal and navigate around insurance issues and getting pre-authorizations or approvals can be quite challenging. And I know that some people, like myself, before I was involved in, Pathway, I always thought that when I got a notification or a response from an insurance company, that it was the tell-all. Mm-hmm. And now I'm starting to realize, after being working in this type of field, that it's actually the opposite. A lot of times when you get the responses, especially when they're negative, usually there's a way around getting a different, submitting it a different way, the claim, or sure. And hopefully that's what we do here at Pathway, is to help you navigate through those challenges, so you can get the right care and get the right surgeries to improve your well-being or a loved one's well-being.
Exactly. We have a little bit more time. You guys had great questions. We went through them pretty quickly. So any other questions or any follow-ups that anyone wants to talk about, or even with patient advocacy in general? We're here, so please ask away. And I see Barry is joining us.
Hello, Barry.
Christine.
There's also, as we're just waiting, I have to see if there's any other questions. We will have other webinars that'll be upcoming. Please, you can look for those in our Facebook page. If you have any questions or would like further information on, any existing cases or just general information, we can be reached at, our phone number is 947-517-3895. Also feel free to email us at advocate@pathwaypa.com.
And so it's just 947-517-8395. Sorry, you just flipped the numbers.
Oh, did I? A little dyslexic.
That's okay. But it's also in the chat too. So if you didn't get that, thank you, Christine, for posting that. Vito, let's see. Did your audio get adjusted? I know you were having some audio issues. Can you hear us okay now? Thank you, Antonio, for your comment. Okay, so Max, you had asked what's a coding error. Did that help explain? Sorry that there's a little bit of a lag, so I wanted to make sure that our answer addressed your question. Do you have a better understanding of what a coding error is now?
I know that, as Elena is looking through the chat and Christine, that coding error, the way when you go to see a physician and they, whatever visit that you're there for, whatever your symptoms are, the office will attach a code next to whatever treatment they gave you, and that will determine that code when it's sent to the insurance company will determine the type of service that you received and whether the insurance company is going to cover it or not. So just a small change of a number can make a treatment being covered or uncovered. And I don't know if I explained that well.
Yeah, no, that's great.
I don't know if you wanted to add to that.
I think that's perfect. You explained it perfectly well. And it's very, interesting because, like we said, there's so many codes and the numbers are so, for one procedure, there could be like 5 or 6 different codes. And some of them, they mean the description is very similar. So it's very easy to kind of select one code and then the insurance only covers the other code or something like that. So there is a lot of issues back and forth with coding that often are the root cause of why things get denied. Where do I find it? Where do you find the code? Okay, so you would have to look, so it depends. Typically, if you look at your bill, you'll see a code on there, and then sometimes you will also have to go back to the notes, like the progress notes, and see how it was documented and so forth. But the bills typically will have it, and that's how you would correlate it with what was sent to the insurance. So if you don't have experience in understanding that, it gets very overwhelming. We, of course, do this all the time. With our background, especially our medical and financial background, we're very efficient at finding these, and because we do it all the time as well. So it's easier for us to, to go through this quickly.
Yeah, Elena, one of the things I wanted to mention too is I believe I've seen situations even in my own, medical bills that I receive that a lot of doctors' offices don't include it. You would have to request it. So, in a lot of cases, you don't even know the code is not transparent to the patient, and they just think that their services have been denied. So there are some situations where you would have to call the office and ask or your insurance company, and ask specifically why it was denied, and that's where you get into the coding conversation.
Definitely. And then the other thing is let's say we didn't really address this yet, but let's say you don't have insurance, or for some reason your insurance in fact does not cover the treatment that you need. Interestingly enough, which many people might not know this, is every hospital or every provider actually has pretty drastic differences in fees that they provide. So, one hospital may charge, let's say, $30,000 for a procedure, and a different hospital might charge $120,000 for the exact same procedure. Prior till recently, as a patient, you didn't really know what the charges were. So now, in recent years, there has been a push to have patients be aware of and knowledgeable of the charges. So now hospitals do have to actually display some or have available to patients what their charges are. And so knowing that, you can go, sometimes it's hard to find, but you can go to their website and really see, okay, this hospital charges, let's say, $200,000 for a specific surgery, where the other hospital, is a fraction of the cost. So if I don't have health insurance and I really need this procedure done, maybe I'm going to look to see which provider I want at the other hospital, because maybe you can afford it a bit more.
Yeah, absolutely. I think one of the things that is naturally happens is that individuals that don't have insurance might look at those costs a little more in detail, because it's not your insurance paying for it, it's out of pocket, or there's a way that you have to figure out how to pay for it, and there may be hidden costs that normally you wouldn't seek or notice, but when you start looking at the fine detail, and that's where from comparing one healthcare provider to another, you're going to find differences.
Definitely. And so it's called no surprise billing. That's kind of the new laws that have been passed and so forth. But it's also important to understand what that means, because one hospital can be, or a facility could be listing, let's say, a procedure as X amount of dollars, but it doesn't, you really have to look into the details of it. What is that covering? Because the other hospital might be breaking it down different.
Right.
So there might be a few different codes associated with it. So you really have to be careful to understand what's the total cost. Because if we take a surgery, you have the cost of the surgeon, the cost of the facility, the cost of the anesthesiologist, the cost of the nursing staff, and all of that. So it all adds up, of course. And then depending on how many stays you're anticipated and things like that.
Yeah.
So it kind of can get spiral into a bigger picture.
Yeah.
And
absolutely.
Max, you had asked, do you do second opinions? Yes, we do second opinions. That's something we
It's a really good question, actually.
frequently do. Yeah, that's a great question.
And I would always, I'm sorry to cut you off on
go
that,
ahead.
but I would actually always recommend that.
Definitely.
Anytime you're giving a diagnosis and need some type of procedure or surgery, to always get more than one opinion. It's almost like, shopping for a very expensive product that you want to make sure that you're getting the best price. And that's something that you're talking about someone's health,
right?
That you should always seek more than one opinion. So that's actually a great question.
Yes, definitely. Especially if you have a rare disorder or symptoms that are not really diagnosed, and then you get a diagnosis and you don't really think it's accurate, or maybe the treatment seems off. Or let's say you got diagnosed with cancer. Cancer is a big one. And it's super time sensitive, right? So some people think, well, I don't know if I have time to get a second opinion. You do. And we can help. We can help you find a very appropriate second opinion in that specific field that you need in a time sensitive manner. And so I don't ever see a negative of getting another opinion. The worst that can happen is you get the same answers, which is actually helpful, because then you
confirms.
Exactly.
Yeah.
Exactly. And I think the other side of it, because, years and years ago, it used to be like, okay, if my doctor or my provider tells me something, I'm just going to go with it and believe them, right?
Yeah.
And you really do want to have a trusting relationship with your provider 100%. But those days have changed where it's not offensive, or it shouldn't be offensive, to get a second opinion to the provider. And a lot of people are worried about that. Like, oh, well, if I get a second opinion, what if my provider gets offended and then they're not going to treat me as well? Yeah. And in reality, if you have a good provider, then they should not care. They should encourage you to go elsewhere, because they would want you to feel comfortable with the treatment that they decide, or go with whatever treatment that you feel better. So if you do encounter that, and I don't think you'd encounter it often, but if you do, then maybe that provider is not the right one for you.
Yeah. And then one of the things that kind of brings to mind to highlight is, I know we had, I think it was Vito that, mentioned clinical trial. Mm-hmm. It's especially more important when you get that diagnosis, or someone that gets a diagnosis that says there's nothing that can be done.
Correct.
Because he mentioned clinical trials, and there's so many different types of clinical trials that are out there. And that's, I think, one of the things that, we've helped patients
yes.
Find and have cured, or given them prolonged mm-hmm. the timing of, whatever diagnosis that they originally given. So that's something everyone should always seek.
Our goal is to really help do the research and make the connection so that you can get into those trials that you want, or get into that provider's appointment to determine if that's the best trial for you. And the other thing is even if you have been told there's no clinical trials, that may be true, but there's still other options to at least explore. So we can help you exhaust all the options, so at least that you feel comfortable knowing that you've looked at everything, think everything's been considered. And so there are instances where, maybe there isn't a current recruiting clinical trial, but there may have been a drug that just or some kind of treatment that just recently ended clinical trial, which is kind of, sometimes even better, because the results, and you can get, and maybe that drug isn't yet FDA approved, but we can still help get that treatment to you by just kind of working through and networking into who we need to reach to see how we can kind of get you in front of the person that's able to help get you that treatment. So there are ways that we can work around it.
Well, we've spiraled into a lot of different conversations.
Yes. Yeah. Any other questions before we kind of wrap up? Great questions, though. We like when people ask questions because it gives us more of a conversation.
Food for thought.
Yes. All right. I think
Is that
I
it?
don't see any more. Oh, yeah. Thank you, Christine, for pointing out. We also do have this on YouTube and Instagram as well. So you're welcome to follow us on any of those. And if you have questions, you can always give us a call. Like Angela mentioned, you can text us or, excuse me, message us on our social media. And let's see.
We're still
Sorry.
getting
I think this is lagging. I'm
messages.
trying to multitask here. Are you only located online? So everything that we do is remotely, but we do service all 50 states, as well as Canada. So we can definitely help in any state. We also virtually will attend appointments for you, or with you, excuse me, and we can really be as available as you want us to be. And the advantage of us working remotely is that we are more readily available, and then we don't have to worry about travel time and so forth. Yep. So thank you. Good question. All right. Well, everyone, enjoy your Sunday.
Yeah, thank you for
And,
joining,
yeah.
everyone. Please look for our webinars that are scheduled in the near future.
Yep.
I don't know the next date.
I think it's
offhand.
February
Next month.
8th, I believe, but it is listed, so I
Yeah.
believe it's February 8th. Christine, if you have it, can you just add that to the chat?
And yeah, please have your neighbors join, friends, whoever you may think that can benefit from hearing any of these topics.
Yeah, spread the word. We'd love to help as many people as we need to.
All right. Thanks
so much.
everyone.
Bye.
Bye-bye.